today I'm going to be talking about Down syndrome and just give you a brief overview of what Down syndrome is. So Down syndrome is the chromosomal condition in which an individual has an extra pair or an extra copy of chromosome 21. So instead of having 2 copies, they have 3. There are 3 types of Down syndrome. There is the trisomy 21, there's translocation Down syndrome, and there's mosaic Down syndrome. The most common type of Down syndrome you can find in a baby with Down syndrome is trisomy 21, and it's just when they have an extra copy of chromosome 21. About 95% of the kids born with Down syndrome have trisomy 21. About 4 to 5% have translocation Down syndrome, and 1% have mosaic Down syndrome, which is the most rare type of Down syndrome you can find. So moving on to what causes Down syndrome, there really isn't anything that can cause Down syndrome, but there is an increased risk that a mother can undergo related to the age. So from ages 30 to 45, the risk of you having a baby with Down syndrome increases just because the frequency of women having or getting pregnant is lower and it's rare. It increases their chance of them having a baby with Down syndrome. The symptoms of a child with Down syndrome, well, they're not really symptoms, they're more so characteristics because they're more the physical aspect of it. So it includes physical things such as short stature, intellectual disability, to have thyroid and heart complications. So it's all more so on the physical side, and of course you can see it kind of mentally. They have a flat facial profile, they have the seeming increase. So it's just more so on the physical side that you can see whether they have Down syndrome or not. So they have more health complications as well. Thyroid, they have more health risks just because they have Down syndrome because of that extra chromosome. How a parent can know that they can have a baby with Down syndrome is there's a prenatal test, there's a screening test, and there's a diagnostic test. And the screening test checks possibility of baby having Down syndrome, but it's not accurate. The diagnostic test tells whether or not the baby has Down syndrome. So moving on to the cure, there isn't one. There's more so care. There's physical therapy, speech therapy, occupational therapy. They need a lot more care just because they can't really look after themselves because of the intellectual disability they have. So at the end of the day, they're just like you and me, just with an extra copy of chromosome 21. So I hope this explains Down syndrome in a more brief, concise way. Thank you.